So let us start. So first we will look at what is general mycology. So the word mycology derives from the Greek word myces. That means it's a type of fungus that was edible. Most of you will be aware of that mushroom are eaten. Thereafter, it was found that these fungus were also associated with not only diseases of plants but also diseases of animals, including human beings. So, the study of mycology generally refers to study of fungus. However, in what we are studying about the human diseases caused by the fungus. So, clinical mycology means we will be studying about the funguses which cause human diseases. So, before proceeding, I think we need to recapitulate a little bit about basic knowledge. So, what are the differences between fungus and other forms of? First is that unlike bacteria, which is a prokaryote, fungus is an eukaryote. So, it will also possess a rigid cell wall, and a very important feature of the rigid cell wall is that it is composed of a material called chitin. This is also very helpful in diagnosis of infections, fungal infections, which I'll elaborate later on. Another significant aspect is that the the cell membrane contains ergosterol. Why this is important? Because when you will be learning about antifungal drugs, you will learn some of the drugs which specifically target the ergosterol moiety that is present on the cell membrane, thereby affecting giving it the antifungal effect. The next part is that হয়েছে কন্টিনিউ করতে পারি না পারমিশন লাগবে next the fungus normally we have seen that all the prokaryotes there is the bacteria they are unicellular organisms but funguses unlike bacteria are predominantly multicellular however some of them can also be unicellular mostly the yeast they are also present in the unicellular form. And the last but most important is that because they lack chlorophyll, so they are dependent on the nutrients on its neighboring environment. Furthermore, the mode of reproduction in these organisms can be both asexual and sexual. That means till now you have learned about the bacteria which replicates by binary fission. That is an asexual mode of reproduction. However, fungus can reproduce both sexually and asexually. Having said that, we can classify fungi into many types. The most common type that is very commonly referred to as whether the fungus is yeast-like or molds. That is the most common differentiation that we generally use. So, what are yeast? Any idea? No idea. You have not even heard about Baker's yeast? What is Baker's yeast? Saccharomyces. What is it used for? Huh? Puffing off. To make bread. Right? That and we also eat all those kinds of yeast. So similarly, yeast can also be commensal, can be pathogenic, and can also be opportunistic. I think now you are familiar with these words. Commensals means which are associated with the human body. Pathogenic means which are not associated with human body and will always cause the disease. And opportunistic means the yeast which can cause disease, especially in immunocompromised or susceptible population. Other type would be mold. Typically, if you keep any food or bread in the open for about 2 to 3 days, you will see a black colored growth is appearing on it. That is a very good example of mold. So this classification is very commonly used even in our medical terms. However, scientifically speaking, fungi has okay. So this is the typical mold. I think you have seen on rotten bread or food items. This kind of black color growth appears. Those are the molds. And on the right hand picture is a picture of growth of yeast on a media. Now coming to morphological classification, these are also based on the mycelium. Among these, a very important categorization is called as dimorphic fungi. As the name suggests, di means two, morphic means two types of morphology. That means we have generally said that yeast will be predominantly two types, either yeast or mold, and some fungi which are not totally true yeast but appears like yeast, which are called as yeast-like organisms. So generally we have seen that fungus can be found in these three forms: yeast, mold or yeast. But there are some fungi which can have both the morphology. That means it can be present in the yeast form, can also be present in the mold form. So what is actually seen is that in the environmental conditions, where the temperature is round about say 25 degrees centigrade, 20 to 25 degrees centigrade, these fungi remain in their mold form. But when these fungi, especially the spores of this fungi, enters into the human body, it causes the infection. And this infective pathogenic form of this fungi is yeast, because human body has a higher body temperature, that is 37 degrees centigrade. So these fungi have both yeast-like morphology and mold-like morphology. Hence, they are called as dimorphic fungi. Among the dimorphic fungi, the common diseases caused in humans are histoplasma, blastomyces, coccidioidomyces, paracoccidioidomyces, penicillium, and sporotrichosis. This is the total list. Among them, these three, blastomyces, coccidio and paracoccidioidomyces, these infections are not seen in India, but what is very commonly seen in India include histoplasma, penicillium, and sporotrichosis. Okay. Now this is the common differentiating feature where you can see yeast-like. If you can see, it's a single cellular organism and it reproduces or multiplies by a system called as budding. That means as the yeast grows, then when it's time to propagate, it will form a small bud at one end. Slowly the bud will increase in size and then separate from the mother cell. Another formation can be seen with yeast is what is known as pseudohyphae. Now before, pseudo means false. Now before knowing what is hyphae, you have to look at the molds. When the molds are seen, they are formed in the form of hyphae, almost like root-like structures. That is called as hyphae. Now these molds can have hyphae in many forms, either septate or aseptate. Septate means there are septations in the hyphae, and aseptate means there are no septations. Now look at this picture where it is called as pseudohyphae. In pseudohyphae, you can see septations, but these are not septations. What these are actually yeast which have become elongated. These are all single yeast cells. Rather than being in a circular form, they have appeared as a elongated form. So apparently it may look like hyphae, but it is not an hyphae. How can we differentiate? Very simple. In septate hyphae, we can see the partition over here, and over here we can see the kinking of the cells at the point of participation. Can you see? There is specific kinking because two different cells are there. Over here it's a continuous cell with partition. So this is how we can differentiate between pseudohyphae and true hyphae. Now this was the common classification that we use routinely. However, we must be aware of the scientific classification. So among the scientific classification we have Zygomycota, Ascomycota, Basidiomycota and Deuteromycota. Now all these are named on type of the sacs that are present. I have already told you the molds will also undergo a sexual reproduction and it will propagate via formation of spores. Now these spores are generally stored in particular sacs. The kind of sac that is present, based on which we can differentiate whether it's a zygospore or an ascospore or a basidiospore, and all the fungi which cannot be classified into the above three forms are called as fungi imperfecti. You don't need to go this into too deep details. Okay. If you can differentiate yeast is like a mold, that is fine. But just keep in mind, scientifically we say Ascomycota, Zygomycota, Basidiomycota and fungi imperfecti. These are the four forms of molds. Just look at this picture. The same, these are the spores, zygospores, ascospores, basidiospores, based on which the classification has been done. And they can also reproduce by asexual. Based on the sexual spore, we have classified. That's it. Now, speaking of sexual reproduction, look at this picture. In the asexual reproduction, what happens is that as the fungi grows on a culture media or environment or on dead and decaying organisms, what happens is that initially there is a formation of an elongated structure. Over here you can see it is called as conidiophore. Phore means the apparatus on which the conidia will grow. Hence it is called as conidiophore. After which there will be growth of the conidiophore and ultimately end with formation of conidia. Now this conidia, after maturing, then will spread to the surrounding environment, and from each conidia another fungi will arise. Very simple. But there is no exchange of genetic information. It is the same strain which will propagate. Hence it is called as asexual reproduction. Understood? But in sexual reproduction, what will happen? The fungi will form either an ascus in Ascomycota, a zygotic sac in Zygomycota, or a basidio sac in Basidiomycota. In that sac, what will happen? There will be an exchange of genetic material, thereby leading to formation of a new type of fungi, like an offspring. Hence, it is called as sexual reproduction. Have you understood? This is very simple. So, on a culture media, what will happen? If I take a single fungi, I put it on a culture media, it will propagate by asexual reproduction. But when two or more same strain of fungi will grow together, it may undergo what is known as sexual reproduction. Okay. So till now we have learned about what is mycology, what is clinical mycology, the common types of fungus which cause human disease. Now let us look into the common fungal infections that are seen in human beings. The first type of infection is called as, see, we can classify them into many forms. The first form is on the depth of invasion. When we say superficial infections, what do we mean by superficial? That means the infections are occurring on the superficial levels. So, what are the superficial area of the human body? The largest organ, that is the skin, then its appendages. What are the appendages of the skin? Hair and nails. So, any infection which occurs on skin, hair, or nails are called as superficial infections. Most commonly, these type of infections are caused by dermatophytes causing ringworm, commonly also called as Dhaja and other types. So, medically we call them as ringworm, or even specifically we can call them as based on the location of the infection. For example, if the location is on the foot, we call it as tinea pedis. If the location is on the body, we call it as tinea corporis. Corporum is body. If it is on the head, we call it as tinea capitis. If it is in the crura, we call it cruris. If it is on the fingers, we call it as tinea angium. Sometimes it can be seen on the face, tinea facie. In the bearded region in males, tinea barbi. Based on the location, we classify them. So these are a type of infections. They are called as dermatophytosis. Keep in mind the word ptosis, that means type of infections. Over here we are talking about skin infections, dermatophytosis. In common English it is called as ringworm, or we can also call it as tinea. Tinea means worm. So these are commonly caused by three types of fungi: trichophyton, microsporum, and epidermophyton. It is very commonly asked, especially in your exams. I think if you try to remember it in this way, you can remember, because the word trichophyton has tri in its name. It will infect both skin, hair, and nails, all. And in case of microsporum, it will infect only skin and hair, and in epidermophyton, will infect skin and nails, but not infect hair. Another form of ringworm is called as tinea versicolor. Why versicolor? Because on presentation there will be different layers of pigmentations. Other than the other infections like tinea nigra, where the color is black, and piedra. Piedra can also be either hyperpigmented or hypopigmented. So these are the common superficial infections. Now let us delve slightly deeper into the structure. If the fungus starts infecting deeper structure, then we call them as subcutaneous infection. That means infection is beyond the skin. So what will be the organs that are affected? Mainly subcutaneous tissue, muscles, etc. These kinds of infection can be seen on diseases like sporotrichosis, mycetoma, or chromomycosis. Now, predominantly what happens is that subcutaneous tissue, including muscles, can be infected. Like in mycetoma, this is also called as Madura foot. Madura foot, the name comes from the city of Madurai. So this infection was very common over there, hence named as Madura foot. So what happens is that this fungal elements gets impregnated into the soft tissue. It goes there and the infection spreads. Slowly and steadily, over time, we can see there is a swelling and a draining sinus. And from the draining sinus, the fungal elements can be seen. Along with that, most importantly, there is localized tissue destruction. It involves joints, it will cause destruction of joints, and obviously the wound will also become non-healing. So this is a kind of infection which is called as mycetoma. Now among mycetoma, later on it was seen that this kind of disease can also be seen to be caused by bacteria. Those are called as actinomycetes. That is not a fungus, that is a bacteria. Hence, mycetoma is now classified into either eumycetoma or actinomycetoma. Eumycetoma means true mycetoma. Mycetoma means fungal infection. Toma means ball or tumor, oma. Right? So mycetoma will actually mean a swelling due to fungus. Eumycetoma means true swelling due to fungus. That means a mycetoma infection caused by fungus. If it is caused by bacteria, we call it as actinomycetoma. The next disease is called as sporotrichosis. Look at this picture over here. The sporotrichosis fungus is very commonly seen on plants. So many a times people, especially gardeners and people working in the gardens, they will get local trauma, especially from rose thorns, etc. And the fungus will enter into the subcutaneous tissue, and from subcutaneous tissue through the lymphatics into the local lymph node. From there, it will grow and spread along the line of the lymphatics, thereafter causing these open wounds with discharging sinuses. This is called as sporotrichosis. This is caused by Sporotrix senki. If you remember, I have already named this fungus in dimorphic fungi. This is a type of dimorphic fungi. And please remember, it is also called as rose gardener's disease. Hence, I have given you the example of gardener who gets an injury through the rose thorn, just to make you remember. But this does not mean it occurs exclusively in gardeners. It can occur in other way also. So it will ultimately present with subcutaneous nodulocutaneous lesions. And the last part is called as chromoblastomycosis. Now look at this picture over here. You can see multiple nodular eruptions that are seen on the either arms or legs. So there is direct impregnation of this fungus. Slowly the wound starts to develop. These are not deep wounds, but there is gross scarring and destruction of the skin. This kind of infection is called as chromoblastomycosis, and these are commonly seen with Fonsesia. This is the name of fungus. If you can't remember the name of the fungus, fine, at least try to remember the name of the disease. The name of the disease is chromoblastomycosis, and it can be caused by Phyalophora, Cladosporium, etc. Another type of infection, of subcutaneous infection, can be seen is called rhinosporidiosis. So, what is rhinosporidia infection? Have you heard about polyp in the paranasal sinuses? So, what is a polyp? Any idea? It's a benign growth. So, many a times, initially, how this disease was identified, people thought those were polyps, but actually those were not polyps. That was a localized tissue outgrowth which have spores of fungi, whitish spores on the tissue itself, especially in the nasal cavity. How does this infection occur? This fungi is commonly an environmental fungi associated predominantly with the cattle. Now, people who share the same water bodies in which cattle are bathed, they will acquire the infection, especially in the nose and paranasal sinuses. when they take a dip in these water bodies, especially ponds and lakes. And this fungi cannot survive at a higher temperature, at 37 degrees centigrade. But it can survive in the paranasal sinuses because the temperature is lower. And it will start growing, especially in the submucosal layer. And when the growth becomes very heavy, it may appear or it looks as if something is growing out of the nasal cavity. This is called as rhinosporidiosis. And the fungi which causes this is called rhinosporidium. Okay. Now these are the predominantly two type of infections. If any other infection which occurs, we call them as systemic infections. Why? Because till now, both in case of superficial and subcutaneous, infections were localized. Now, when I say localized and systemic, what is the main point of differentiation? At least from the therapeutic point of view. So, any infection which is a systemic infection, we need to treat the body as a whole. Whereas in localized infection, we can go for localized treatment modalities, including surgery or even topical treatment. But in case of systemic infections, we cannot give any kind of topical treatment. We have to give systemic infections, systemic antifungals and other drugs. So when we say systemic mycosis, that means the infection is spread throughout the body. So let us look at the systemic mycosis. First part is how this occurs. Most commonly, systemic infections outside the healthcare facility will occur through the respiratory route. When a person will inhale the spores, any kind of spores, whether sexual, asexual, doesn't matter. Any kind of spores, the person will inhale. And then what will happen to the inhaled spore? What is the first line of defense? Nasal hair, fine. Next, nasal mucosa, the escalator mechanism, which throws out all the particles that are collected when we start breathing, right? Now, if all these local part of the innate immune system are altered, what will happen? The spores will reach in the respiratory epithelium, right? So, who are more prone? Like people with COPD, other chronic respiratory infections, so they cannot throw out the whatever they have inhaled. This will then gain access into the respiratory tract. Now, what are the local cells which prevent infections in the respiratory epithelium? What are the tissue macrophages of the pulmonary bed? আচ্ছা, অ্যালভিওলাইতে কি টাইপ অফ সেলস পাওয়া যায়? স্কোয়ামাস, বেশ। আর বাকি জায়গায় কি পাওয়া যায়? বাকি জায়গায় কি পাওয়া যায়? সিলেটেড, কত দূর অব্দি সিলেটেড এপিথেলিয়াম থাকে? আপার রেসপিরেটরি ট্র্যাক্ট পর্যন্ত সিলেটেড এপিথেলিয়াম থাকে। আপার রেসপিরেটরি ট্র্যাক্ট আর লোয়ার রেসপিরেটরি ট্র্যাক্টের ডিফারেন্সিয়েশন কোথায়? অ্যানাটমিক্যাল ডিফারেন্সিয়েশন এই অ্যানাটমি ফিজিওলজি একটাও পাচ্ছ না তো? হোয়াট আর নিউমোসাইটস? নিউমোসাইটস কি? আরে বলো, তোমরা বলো, গ্রুপ ডিসকাশনের ক্লাস। How many types of pneumocytes are there? Type 1 and type 2. What are the functions of type 1 and type 2 pneumocytes? Hmm? Gas exchange. Type 2 সারফেক্টেন্ট। আর কি সেল থাকে? টিস্যু ম্যাক্রোফেজ থাকবে না? So normally what will happen when the spores of the fungus reach the alveolar bed, they are destroyed by the tissue macrophages. Initially taken up by the neutrophils and then slowly destroyed by the macrophages. Now, if a person is there in whom the innate part of the immune system is altered, either iatrogenically or any other disease, what will happen? This spore will survive. And what the spore will do? It can either germinate in the lung bed or it can go into the bloodstream. Very rarely, especially in people who have structural but healed lung parenchyma. For example, post-tubercular fibrosis. The patient had tuberculosis, there was a localized damage, now the damage is controlled by fibrosis. Now in that fibrotic region, no immune cells will be there. The spore will germinate and will form something what is called as fungal ball. Suppose there is a cavity in the lung, in the cavity we can find fungal ball. But if the immune system is, say, it cannot contain, what will happen? From the pulmonary bed, the fungus will go into the bloodstream. And from there, the spore will germinate to form, in which form? In the mold form, by forming hyphae. Okay? And this hyphal form will invade the blood vessels. Very commonly, we will see pulmonary infections. And those type of infections we categorize based on the type of the fungus that is infected. For example, if the infecting organism is Aspergillus, we call it as pulmonary Aspergillosis. If it is, say, a zygomycosis, we call it as pulmonary zygomycosis. If it is a Cryptococcus, we call it as pulmonary Cryptococcosis, based on the type of the fungi which infects. Bottom line is, almost all infections will be acquired naturally through the pulmonary route. And once it invades into the bloodstream, it can reach anywhere in the body, any region. For example, like Cryptococcus, initial infection is acquired through the respiratory route. So the first type of disease that will be seen is pulmonary Cryptococcosis. Then it will enter into the bloodstream. Then we call it as cryptococci in the blood. From there, it can reach into the brain and CS in the meninges. It can cause cryptococcal meningitis. It can also cause skin infection or skin ulcers. So once it reaches the bloodstream, it can give any kind of presentation. Hence, all these infections are called as systemic mycosis. Understood? Okay. Now come to the last part of organism called as opportunist mycoses. As I have already said, opportunist mycoses are all the fungus which are commonly associated with the human being, may or may not be a commensal, but when given a chance, it can cause infections. The most common organism which cause opportunist infections is Candidiasis. Now, when I say Candidiasis, that means it is the invasive form of Candida. Normally, Candida is associated with the human body. You take a swab from your mouth, you will find Candida. You take the gut flora, Candida will be there. You take any sample from the skin, Candida will be there. But normally these infections are not seen. Or sometimes it can be seen in the localized form. Localized, for example, say a newborn whose skin does not have Candida, but it acquires the Candida from the environment. It can cause localized skin eruptions. Do you know what this condition is called? It is also called as diaper rash, found especially in small children. The mothers make them wear the diaper, and they will pass the urine. The diaper will become wet, and the wet skin will get infected with candida. This is commonly called as diaper rash. That's a localized infection. Another very common is seen especially vaginal candidiasis. You will find many patients, especially in the females in the reproductive age group, will complain with whitish discharge. This is because of vaginal candidiasis. This is not infection. Rather, what happens is overgrowth of the candida. So these are localized, or say oral thrush. This can be seen in patients who have been given antibiotics for a prolonged period of time. So normally our mouth will have many types of bacteria and fungi, like candida. Now if the patient is receiving antibiotics for a prolonged period of time, what will happen? All the bacteria in the mouth will die because of the antibiotics. And who will grow? The candida that remains, it will grow. So there will be overgrowth of candida in the mouth. This is also called as oral thrush. But keep in mind, these are all localized infections. Sometimes this candida may enter into the bloodstream, and once it enters the bloodstream, it can cause any type of disease. Pulmonary candidiasis, candidemia, that is candida in the blood, candida meningitis, any other systemic infection. Now, one very important point that you should remember, in the hospital setup, many patients will have intravascular channels, either peripheral lines or central lines. Now, candida is present on the skin. So, if proper infection control measures are not followed, this candida of the skin present on the patient's skin itself may enter into the bloodstream through these iatrogenic channels. Okay. Hence, these patients are more prone to have candidiasis. Understood? Another would be cryptococcosis. This cryptococcus is present especially in the environment, associated with eucalyptus trees and many other associations. But normally we do not generally find people infected with cryptococcus. Very rarely. But we can observe these infections in a particular set of population, like people who are infected with HIV. Because in HIV, both acquired and innate immune system is altered. Hence, this yeast can cause infections, even though acquired from respiratory route. For example, if you and your friends, we inhale this yeast, we will not get disease because our body will able to clear the yeast, especially to the macrophages. But people who have deranged immune status like HIV or immune suppression or post-transplant patients, they can have this infection. Okay. Another important infection is called as zygomycosis. During the COVID period, I think you would have heard that, especially in the second COVID wave of in the second wave, in the newspaper it was very frequently reported black fungus. Have you heard? People getting infected with SARS-CoV-2 virus, they are put in the hospital, and then later on it was found that they were infected with a black fungus. So these black fungus are the zygomycosis. Why black? Because they have a tendency to affect the vessels. When they affect the vessels, the blood gets altered over locally and causes a black discoloration. This black fungus is generally caused by Rhizopus mucor or Rhizomucor. These are very commonly seen, infection is very commonly seen in the perinasal region. Sometimes they may even into the brain, especially the frontal lobe of the brain. And these infections are more commonly seen in patients who are admitted in the critical care units and getting systemic steroids, because systemic steroid will decrease the immune function. So you will learn about these infections more detail in the theory class. I am just giving you an overview over here. And finally, aspergillosis. You can find aspergillus very commonly in the environment. Put a bread outside for 3 days, you will find aspergillus colonies, green or black color colonies growing on. So we are always surrounded with aspergillus spores. But again, we are not getting infected because our immune system is preventing them. So any kind of immune suppression, either short term, long term, or a permanent immune destruction, can cause infections by aspergillus, which are called as aspergillosis. Similar to aspergillosis, another disease is very common, especially in people who have a tendency to use intravenous drugs. That very common infection is called as penicillinosis, caused by Penicillium malifide. However, the name has changed. You can remember penicillin, that is enough. The last form of fungal disease is called as mycotoxicosis. As the name suggests, myco means fungal, toxicosis means toxin induced diseases. Now, many fungi, uh, I think you have heard that there are specific types of mushrooms, if eaten, can lead to hallucination, right? Similarly, there are many fungus which can produce some elements which can cause poisoning in human beings. In pharmacology, you have read about ergot poisoning. Ergotamine is used for therapeutic purposes, but in excess it can cause poisoning. What is the source of this poison? This is the fungus. So there are many types of funguses which produce many types of toxins. Some can be used for human benefit and some can cause human disease and even death. Like, I think you have heard about aflatoxins. These are fungus which grow on rice and wheat sacks that are stored in cold storages. And the fungus will grow, it will produce the poison and then die off. But the poison remains in the food grain. So if the people ingest those food grains without proper cooking, will end up having toxemia. So I'm not going into the depth of all the toxins. These are called as toxins. And recently, you should also know another type of disease which is called as microsporidiosis. There was a lot of debate whether this is a fungus or a parasite. Later on, with the genetic confirmation, it has now been confirmed that this is a type of fungus. So I'm not going into the depth and details of this. This is beyond your scope. Just at least keep this in mind that microsporidiosis is also classified as fungus. So having said that, let us look in how we can go for the laboratory diagnosis. So first will be the sample. Now from where the sample has to be taken, this will depend on the kind of infection we are looking at and the type of infection which we are looking at. For example, let us look at the first type of infection, that is the superficial infection. So what will be the type of samples we are looking at for superficial infections? So for skin, we can take skin scrapings, right? Or we can take the cut, we can cut the hairs, affected hair, or nails. If we are looking at an infected nail, we can take the nail. Now, if we are looking at, say, subcutaneous infections, what would be the sample? The best sample will be take a localized biopsy of the area, also called as the punch biopsy. That would be the best sample, because in subcutaneous infection there is no role of skin scraping or swabs, etc. Because the fungus itself is present in the subcutaneous tissue. So the best option would be you take the biopsy specimen. And if the infection is systemic, what will be the sample? Based on the site where it is affecting. For example, if you are looking at signs of meningism, the sample would be CSF. If you are looking at, say, sepsis like features, we have to take the blood for culture. If we are looking at the pulmonary infection, we may even have to take a lung biopsy or a bronchial brush sample, etc. So, based on the type of the symptoms, we have to take the clinical samples. Now, what to do with what kind of test we can do? The first would be direct examination. So, in direct examination, what we do? Any idea? Like in all other previously topics we had discussed, in direct examination, what we do? Microscopy and direct microscopy and wet mount. So over here we can use, there are many types of staining methods. For example, we can start with the gram stain. Yeast can be stained with gram stain and it will appear as gram positive. Secondly, we can do a direct microscopy with what is called as KOH mount. So what is this KOH mount? What is KOH? Why potassium hydroxide is used? Can anybody answer? See, the fungus is present within the human tissue. So, to observe the fungal elements, we need to get rid of the human tissue first. So, how can we do that? We are using KOH or potassium hydroxide. What is potassium hydroxide? It's an alkali, it's a base. So, what it will do? সেলের উপর কি এফেক্ট হবে? হাইড্রোক্সাইল তো রিলিজ করছে। What will happen to the human cells? Human cells will disintegrate. Now keep in mind the fungals have a cell wall, so it can resist the action of KOH, but human cells can't. So when you put the tissue on KOH, the human tissue will disintegrate, but the fungal elements will remain. Hence we can observe them under the microscope. Okay. So on direct microscopy, we can do, for example, a gram stain, we can do a KOH preparation, or we can even use specific fungal stain. Very commonly, one is known as GMS or Gomori methamine stain. So these are like a PAS stain, periodic acid strip stain. So these stains specifically stains the fungus in the tissues. Okay. Next, what we can do? We can do for culture. Go for culture. Very commonly, for fungus, we have to use some media which will help for the growth of fungus. Like, do you know any media which is used for fungal culture? What is HDA? Sabarod dextrose agar. So these are specific media which are used for culture. Another method of diagnosis can be by using serological methods. Now, what type of serological methods? Normally, human bloodstream will be devoid of fungal elements, right? So, any kind of fungal antigen present will indicate invasive or systemic infections. So, these can be detected by serology, like assessing the beta glucan assay or galactomannan assay. I am just outlining all the. And last part is we can go for molecular methods. The favorite response from you people, like nucleic acid amplification test in the tissue or affected region. So what are the main modalities? Will be direct observation of the fungal pathogen, or culture of the fungal pathogen, or we can use serological methods in which we detect fungal antigens or antibodies against fungal antigens. And finally, we can go for nucleic acid amplification test. Another kind of stain is called as Calcofluor white stain. So this stain is used for fluorescent microscope. What is the advantage of fluorescent microscope over normal microscopy? Sensitivity is higher. We can detect more easily. Okay. One important part is Lactophenol Cotton Blue. Just let me describe what it is for you. For example, we are suspecting a patient is having a fungal infection. We have taken the biopsy of that patient and we have put the biopsy material for culture. Let's say after 1 week there is a growth of a mold. Now we need to identify the kind of mold, the type of mold, and what specific fungus that is causing the infection. For that, we need to examine it under the microscope. That process of examination is facilitated by a particular kind of stain called as Lactophenol Cotton Blue. So, what is the importance of these things? Phenol is a. What is the role of phenol? Anyone? Very good. Phenol disinfects the fungal strain so that the person who is observing under the microscope is not infected. Cotton blue will stain the fungus. Cotton blue is a type of blue color which will stain the fungus. And what is the importance of lactic acid? It will decrease the pH of the solution so that when we have prepared the mount can remain as it is for a slightly longer period. So this helps us in identification of the fungus. Okay. Acha. For doing culture, we need to put the clinical sample on a culture media and incubate. What will be the temperature of incubation in case of fungus? Anybody else who want to give his or her opinion? No. One of your colleague is saying 25 degrees centigrade, other one is saying 37 degrees centigrade. Anybody, any other opinion? Obviously, it will depend on the type of infection we are looking for. If we are suspecting yeast infections, we have to incubate at 37 degrees centigrade. If we are looking at mold infection, we have to keep it at 25 degrees centigrade. And if we are looking at an infection caused by dimorphic fungi, we have to keep at both 27 and 30, 25 and 37 degrees centigrade. Understood? As simple as that. So yeast will appear like small round cells. Furthermore, if the yeast is producing pseudohyphae, we can see pseudohyphae like long prolongations. Now, you can get confused whether it's a true hyphae or pseudohyphae. So, you have to look at the constriction necks in these regions. Like this one. Can you see over here? It's constricted. A single cell over here, a single cell over there. Hence, it is a pseudohyphae. Now, this is another type in which you can see these structures and there are septations in between. Okay. So, these are called as septate hyphae. Now, one more important feature. What is the color of this hyphae? Basically colorless or as same as the slide, right? So, these are also called as hyaline hyphae. Hyaline means almost transparent. That is the color that is seen. Remember, I have told you about black fungus, zygomycetes. They will have slightly pigmented hyphae. Hence, they are called as pheohypomycosis. Pheo means colored or black color. Now, another important is, can you see their branching over here? Some of the fungus will have a typical branching pattern. This helps in identification also. That is the point. If you remember, that's fine. You don't need to learn about, because when you will be reading about the funguses, there will be description like branching hyphae. So this is what you mean by branching. And the last part is on KOH. Now look at this hyphae. Can you say any difference between this one and the previous one? This one and this one? First is, this one is very thick, right? Secondly, almost there are no partitions in the hyphae. So this is called as broad aseptate hyphae. This is the kind of pattern that is seen with zygomycetes. Why I am telling you all this? Because the laboratory, when it is not sure, cannot give a specific name to the fungal pathogen. What the laboratories will report is the type of the description of the fungal element that is seen. You must be aware of the typical description so that you can derive what kind of infection it could be possible or not. That is the reason why I am telling you all this. So that when you read a report in which it says broad accepted fungal hyphae seen, you must understand there is a possibility that this could be a zygomycetes infection. বোঝা গেছে? So next time when you read about the fungus, read about the description of the fungus, especially in the tissue samples. So that when you read a microbiological report or a pathological report, you can decipher the kind of fungal infection that was possible in that case scenario. One very important part is, I have already told you Cryptococcus, it causes cryptococcal meningitis. Now, like bacterial infections of the meninges, what we do is gram stain of CSF for rapid identification. For example, strep pneumonia. If we are suspecting streptococcal meningitis, that is a medical emergency. Similarly, for fungal meningitis, we need to observe the CSF under microscope. This will help us in deciphering the causative pathogen. Over here, we are discussing about Cryptococcus. Hence, procedure. Now, this is where he had ended, right? Now, in India ink, there are some stain particles. Those particles have negative charge. That is the reason why India ink is used. Now, why negative charge is used? Because this Cryptococcus have a thick capsule around it, and this capsule will have negative charge. So, because of the negative charge, what will happen? The ink particles will be deflected away from the capsule, and what we will see is a negative image. A negative image where we can find the stain or India ink over here in the background, but we will not see the stain where the organism is present, because the capsule deflects all the stain particles. Hence, this type of staining is called negative staining. Understood? For example, if we have used gram stain, we will call it as positive stain. Why? Because in gram stain, the organism would have been stained, but the background would not have been stained. Over here, the background is stained, but the organism is not stained. So this is called as negative stain. Over here, we have used India ink, another stain that can be used, also known as nigrosin. Now over here what we can observe under the microscope is we can see a circular shaped yeast with a huge capsule around it. Hence, on examination of the CSF, we can say we have observed capsulated yeast in the CSF. This would indicate we are referring to Cryptococcus. Understood? And I have already told you for yeast we can use gram stain. On gram staining, it will appear as gram positive because it has got a thick cell wall. Once the crystal violet penetrates, it will not get decolorized by acetone or alcohol. So it will appear as gram positive. And on we can also see pseudo hyphae over here. And on gram stain, you can appreciate these cells even better. Now you can see clear difference. You can see clear line of distinction between these two cells. Like this is a direct sample taken from oral thrush. So over here, what we are observing, plenty of budding yeast cells. Budding, I think you can observe it over here. There are small budding. So we call it as budding yeast cells with pseudohyphae present. So this would be the kind of description on the direct. Recapitulate in a nutshell. Mycosis means fungal infections of human body. Funguses causing human body can be classified into two types, GMS or PAS. Similarly, histopathological examination and specific histopathological staining can also reveal the organism, especially in biopsy samples. Both biopsy samples and clinical samples can be put for culture. However, problem with the culture is fungus takes a much longer time to grow. Next part of diagnosis is serological diagnosis, where we look for fungal antigens or antibody against the fungal antigens. Two very commonly used fungal antigens are beta D glucan. D means for D, levodextro. That is the beta D glucan that is used for diagnosis of systemic candidiasis, or galactomannan assay, which is used for diagnosis of systemic aspergillosis. Finally, on the tissue or clinical sample, we can use nucleic acid amplification test for confirmation or diagnosis. These are the diagnostic modalities for fungal infections.